Hi again. So this video is a continuation of our topic for this week, the part 2 of our physical examination of the eyes. Okay, so before proceeding with our discussion, let me again present to you this disclaimer slide. All right. Again, those are the learning objectives of this presentation or of this topic for this week. Okay, so moving on to the physical examination of the pupils, which is part of your eyes. Okay, so you have to note the following if there is abnormality in the size, the shape, and the symmetry. Of course, the pupil should be equal in size and it should be symmetrical. Okay, you have to note if the pupil is larger than 5 millimeter or less than 3 millimeter, or if it is unequal, you have to measure them. Okay, note also for the pupillary reaction to light. Okay, we have two types of pupillary reaction to light. Again, we have the direct reaction, okay, which refers to the pupillary constriction in the same eye. Diba yung pinakita natin in the previous video when the light is detected by the retina on the left eye, so parehong nagko-constrict ang pupil ng both eyes. So that is called direct reaction. On the other hand, consensual reaction is the pupillary constriction in the opposite eye. So yun yung tawag doon sa opposite eye. Okay, so this image shows an example of the sizes of the pupil. But of course, this is bigger here kasi this is in your presentation, diba? But there is sizes of the pupil that you can found in your pen light. Okay, so makikita mo yung sizes kung 1 mm or 5 mm or 7 mm. Okay, so in the dim light, you have to inspect for the size, the shape, and the symmetry of each pupil. Of course, galing sa side. Yan, ganon mo yung pen light. Okay. So we have the term called meiosis, no? It refers to the constriction of the pupils. And we have mydriasis, yan, or dilatation of the pupil. Those are the terms used in describing the pupil. Okay, so these are the abnormalities of the pupil or the abnormal findings. We have what we call the tonic pupil. It is sometimes called a ditonic pupil or simply the AD pupil. Okay, it is the term used to denote a pupil with parasympathetic denervation that constrict poorly to light. Okay, but reacts better to accommodation. Or kapag nilapit mo di ba yung to check for accommodation is to ask the client to look at the object, no, hanggang from farthest to nearest. Pag nag-near yung object, you can observe that the pupil constricted or constrict. Okay? And we have here another abnormalities or the oculomotor nerve paralysis. So these are common for the patients who have third nerve palsy or who have a history of horizontal or vertical binocular diplopia or mitosis, or it complains of enlarged pupil. Yan. So, nakita nyo may enlarged pupil or difficulty in focusing. Okay, with involvement of accommodation. So, kahit na malapit yung object. Okay? So you have to note also for the abnormal findings of the pupil. Okay, this is the normal findings. No, kapag ano ka ng light sa pupil, nagko-constrict ang pupil, or this is the normal size of the pupil. While this, another one, meron tayong tinatawag na anisocoria, or there is an unequal pupils. Okay, there is an abnormal pupil dilation. Ayan. So, malaki yung isang pupil while the other pupil is in normal size. Okay. Okay, so another abnormal finding of the pupil, we have what we call the Horner syndrome. Okay. It is a combination of signs and symptoms that is caused by the disruption of the nerve pathway from the brain to the face and the eye on one side of the body. So, it results in decreased pupil size. So here, merong decreased pupil size, meron ding drooping of the eyelid. Okay, so another abnormality is meron tayong small and irregular pupil size. So, look at this example, no? We have equal pupils. Yan, okay. Yung one eye is blind, pero equal pa rin yung kanilang pupil. Okay, kapag nag-ano ka ng light dito sa eyes na nakakakita or sa good eye, okay, so nagre-reflect din siya or nagko-constrict rin yung other eye. So, ang tinatawag natin doon is, diba, kapag ano ka ng light dito sa one pupil, meron tayong direct reaction, and then yung sa other side tinatawag natin consensual reaction of the eye. So same then dito sa another picture or image. Okay, when you place a light or when you light the blind eye, it will not respond. So, walang reaction. So, nakadilate pa rin siya. So, wala siyang reaction. Same then with the, walang direct reaction. Same then with the other eye. Okay, so dilated pa rin. Hindi siya nag-constrict. Right? Okay, let me share to you this mnemonics, no? The mnemonics that you have to remember when you are checking the pupil of your patient. Remember the PERLA. So, PERLA stands for pupils equal, okay, round. Of course, that is the shape of the pupil. And it should be reactive to light and accommodation. Okay? Moving on to the physical examination of the extraocular muscle of the eyes, you have to assess the movement or the movements of the eyes. There should be a conjugate movement in each direction. You have to document if you notice nystagmus. Okay, when we say nystagmus, there is an involuntary rhythmic side to side, up and down, or in a circular motion, umiikot yung eyes, that occurs with a variety conditions, lalo na kapag may disorders in the labyrinth, no, and the cerebellar system, or doon sa mga patient with drug toxicity. Okay, also seen in some patient with neurologic conditions. Note also for the lid lag, that is again common for those patients who have or who are diagnosed with hyperthyroidism. Okay, to continue with the assessment of the extraocular movement, you have to note for the cardinal fields. Okay, yun yung ano natin, di ba, palatandaan in checking the extraocular movement of the eyes. So you can use again the finger or your finger or the tip of your pencil, and then you can ask the client to follow the movement, the six movements or the six cardinal fields, no, from the superior, okay, tapos to the inferior oblique, then pag ganyan, tas back naman, and then to the inferior rectus, and then lateral or medial rectus. Okay, yan. So the 6 movements. You have to instruct the patient to hold the head still and just move the eyes. Of course, hindi nila susundan ng ganyan. Eyes lang. The deviations may signal brain tumor or injury. So, ito, yung pag-perform nito of how to do this, makikita nyo rin sa aking video sa RLE. Okay, for the skills on the physical examination. Alright, so these are the cardinal signs, no, or the cardinal movement of the eyes. So, doon siya nakatingin, tapos ipapamove mo naman sa other side, okay, sa side to, sa medial. So, you're checking for the superior, okay, then, okay, sa baba or lower, inferior, okay. So, looking right, this is looking to the left. So, you can see there is an abnormality of the eyes, no? Hindi parehong sumunod yung kanyang eyes. Okay? Or yung eyeball. Okay, so we have to note also for the suspect lid lag. That is common again to those patients who have hyperthyroidism. Same with the proptosis. Okay, so this is also known as exophthalmos. Okay. So let's proceed to checking of the convergence of the eye. Okay, so when we say convergence, it is the ability of the eyes to turn the two eyes inward toward each other. So yung parang naduduling ka, okay, to look at a close object. Okay, so we depend on this visual skill for the near work activities, diba? Such as desk work or yung mga ginagawa natin na kailangan natin tingnan sa near vision natin. Okay, does the eye converge? Alright. So, moving on to the another findings, we have this conjugate gaze. Okay, we have what we call esotropia, wherein there is an inward deviation. So as you can see, no, it is a type of strabismus or eye misalignment in which one or both of the eye turn inward. So dito siya. So yan, parang itong left eye ko. And then we have the exotropia, or the outward deviation, okay, or it is also known as an outward turning of the eyes. That is common. That is a common type of strabismus, accounting for up to 25% now of all the ocular misalignment in the early childhood. Nako-correct naman to through surgery. Okay. So, to check for the corneal light reflex, you can stand at least 2 feet in front of your client or your patient, and then you can shine a light into the patient's eye. Okay. And you have to ask the client to look at it on the pen light. Okay. So, you have to note for asymmetry of the corneal reflection that might indicates a deviation from normal ocular alignment. Okay, so shine mo yung light at the side. Okay, so this image shows another example of this conjugate gaze. By the way, this conjugate gaze is a failure of the eyes to turn together in the same direction. So we can detect this by doing the cover and the uncover test. The cover and the uncover test may reveal a slight or a latent muscle imbalance that are not seen otherwise. Okay, we have here the cover in the end cover. So the right eye, okay, this is the right eye, moves outward to fix to the light, okay, while the left eye, which is not actually seen because it is covered, it moves inward to this to some degree, okay, while the uncover, okay, so you can observe that the left eye moves outward to fix on the light kasi meron kang pinakitang light, while the right eye, okay, ito yung right eye deviated inward. Okay. Okay, so this conjugate gaze is actually a result of the problem of the left cranial nerve number 6 paralysis, okay? Or your cranial nerve known as the abducens, which is responsible in controlling the movement of the lateral rectus of the muscle of your eyes. Okay, so looking at this picture or at this image, okay, so when the patient here is looking to the right, the eyes are conjugate. While when the patient is looking straight ahead, you can observe an esotropia. Mayroong konting esotropia that appears, okay? While the patient is looking to the left, esotropia is maximum. Ayan, sobrang nakapasok na yung kanyang isang eyes. Okay? Okay, so another image of the left cranial nerve number 4 paralysis. Now, when the patient is looking down and to the right, okay, the left eye cannot look down. Okay, yan. When turned inward, so the deviation here is maximum in direction. So here, this is an example of the left cranial nerve number 3 paralysis. Your cranial nerve number 3 is your oculomotor nerve. It is responsible for the movement of the eye muscles, constriction of the pupil, focusing of the eyes, and the position of the upper eyelid. Yan. So, makikita nyo yan when the patient is looking straight. Okay, yung isang eye nandun sa dulo. So, naka-straight, dapat naka-straight lang. Dapat both are in the center. Okay, so the upward, downward, and inward movement are impaired or lost. Okay, so nagkaroon ng ptosis or pupillary dilation. So you can see, no, naka-constrict or maliit yung isang pupil dito, while on the other eye, dilated ang kanyang pupil. Okay, so moving on to the physical examination of the internal structure of the eyes, particularly the retina, wherein ophthalmoscopic examination is usually done. Okay, so you can do it without dilation or without dilating the pupil of your patient. Okay, but sometimes some ophthalmologists they dilate the pupil using a mydriatic, no, to dilate the pupil to be able to clearly see the internal structure of the eyes, particularly the optic disc and the retina. Okay. Okay. So, in examining the optic disc, you need to adjust the setting of the ophthalmoscope. Okay. Initially, you have to do the following. No, you have to use the brightest light, that is to visualize the retina and the blood vessels inside the eyes. Okay. You can use white color because it ignores the other color inside. Okay. the circle, it ignores the slits in the crosses, and you have to adjust the setting of your ophthalmoscope at 0 or O diopters. Okay, you need also to decrease the room lighting, hindi masyadong matingkad yung light, and you have to ask the patient to remove the eyeglasses, of course, kasi malapit dapat yung ophthalmoscope. However, sa mga ophthalmologists talaga, meron na silang mga machines na ginagamit, no, na hindi na ophthalmoscope. Okay. You have to adjust the positioning of your client, okay? Especially when you are looking in the right eye, you have to hold the scope with your right hand, okay? When looking in the left eye, you have to hold the ophthalmoscope with your left hand also, okay? You have to use opposite hand to hold eyelids, para i-open mo yung eyelids ng patient, to open it or to determine the proximity of the patient. So it is important to master the technique of using the ophthalmoscope for us to avoid touching the nose of the client. So to start with the examination of the internal structure of the eyes, you can start by eliciting red reflex. Yan, may ilaw yan, red light sa loob. Okay, so now let's proceed to the examining of the optic disc and the retina. Okay, diba? You have to start with the red reflex, okay, sa iyong ophthalmoscope that comes into view, and then you have to look through the red reflex to visualize the arteries and the veins. Okay, so arteries and the vein. Okay, you have to follow the vessels medially down towards the nose and look for the round yellowish orange structure that is described earlier at the optic disc. So, yan yung optic disc. Okay. So, you have to bring the optic disc into sharp focus by adjusting the lens of the ophthalmoscope. Okay. So, you can adjust the setting of the ophthalmoscope into 0 if both has no refractive errors, both the patient and the examiner. Or if you are myopic, or the patient is myopic or nearsightedness, you can adjust it into negative sa kabilang side, or positive, okay, or you adjust clockwise if the patient or the examiner is hyperopic or farsightedness siya. Okay, you have to find the yellowish, no, diba kanina, white depression of the optic disc, okay, from which the retinal vessels appear to emerge. Okay. Yan yun. So, these are the physiologic cup of the eyes. Okay, the central cup and looking at the temporal cup. Okay, usually the findings, okay, yung disc daw may, the disc, yung kanyang margin is somewhat blurred, so that's just normal. So, the color of the disc is usually yellowish to orange or creamy pink. Yellowish to orange or creamy pink. Yan. Okay, when looking at the ophthalmoscope, you may find the following in the internal structure of the eyes or in the retina of the client. Okay, these are the rings and the crescents, okay, that are often seen around the optic disc. Okay, these are developmental variation or genetics. and these are not part of the optic disc because these are located just around or outside the optic disc and should not be included in your estimates or in your findings. Okay. Another finding is the midulated nerve fibers. Okay, it is much less common but dramatic findings. Diba? Ikaw kaya makakita ng ganyan. So you might be thinking of this is abnormal, no? Okay, it appears as irregular patches with feathered margins. Ayan, they obscure the vessels of the retina, but it has no pathologic significance, meaning these are just the normal variations of the optic disc. So now, these are the abnormalities of the optic disc. We have what we call the papilledema. Okay? Papilledema is a venous stasis that leads to engorgement and swelling of the retinal vessels. It is pink in color, hyperemic, okay, wherein the physiologic cup is no longer visible. Okay. Another one is the cotton wool patches here, no? The cotton wool patches. Okay. This is an abnormal finding on the fundoscopic examination of the retina of the eye. They appear as a fluffy white patches on the retina. Okay, they are usually caused by damage to the nerve fibers and are a result of accumulation of exoplasmic material within the nerve fiber. Yeah, so these are considered abnormal findings. So, another abnormalities of the optic disc or the abnormal findings of the optic disc is we have glaucomatous cupping. Okay, this is due to increased pressure within the eye that leads to increase yung kanyang cupping. Okay, there is a backward depression of the disc and there is atrophy. Okay, the base of the enlarged cup is usually a pale. Okay, the retinal vessels yan, sink in and under. So, it may be displaced. Ayan, napapansin nyo distally. Okay, we have here a view or a picture or an image of a optic atrophy. No? Yan. Okay, so in checking or in assessing the retina for the arteries, the veins, the fovea, and the macula, or the four areas, you have to follow the following sequence of inspection from the disc to macula. So may mga numbers yan, okay? So this is how you will check or look at, no, looking at the internal structure of the eyes using the ophthalmoscope. Okay. So, to differentiate the arteries and the veins, okay, you have to look at for the color. So, the arteries is usually light red, while the veins are dark red. Okay, the size of the arteries are smaller, 2/3 to 3/4 the diameter of the veins, while the veins are larger. Okay, for the light reflex or the reflection, usually the arteries are bright, while the vein is inconspicuous or absent. Okay, you know that the vein carries an oxygenated blood, while the arteries is oxygenated blood. Kaya sila ay red, di ba? Right. Okay, so this image is an example of the normal fundus of a fair-skinned person. Okay, wherein you have to inspect the optic disc, okay, and then follow the major vessels in the 4 directions. Okay. Noting their relative sizes or any arteriovenous crossings. Yan, yung mga crossings na yan. Looking at here, they're all normal, no? And you have to inspect also for the macular area. Okay, the fovea is slightly darker. Okay, it is discernible. Okay, there is no light reflection is visible in this image. Okay, you have to look also for any lesions in the retina. Ayan. So, ito yung example ng normal fundus. Okay, so moving on to the retinal arteries and the arteriovenous crossing for normal patient and for the hypertensive patient. So this one is an example of the normal retinal artery and arteriovenous crossing. So the normal arterial wall is transparent. Only the column of the blood within it is usually be seen, as you can see in this picture. Okay, the normal light reflex is narrow. Yan. Because the arterial wall is transparent. Okay, transparent yung arterial wall. The vein, okay, crossing beneath of the artery can be seen right up to the column of the blood on the either side. So, nandito yung vein. Nakikita natin siya dyan. Reflection. Okay, this is for the normal patient. On the other hand, okay, this image shows the retinal arteries in the hypertensive patient. So, in hypertension, the arteries may show areas of focal or there is a generalized narrowing. Yan. Focal narrowing. Okay. Narrowed ang kanyang column of the blood. Narrowed din yung light reflex. Okay. So, the arterial wall thickens and it becomes less transparent. Kung i-compare nyo sa previous slides, malaki yung nasa gitna dyan na transparent. Okay? So, for the hypertensive patient, pwede rin magkaroon ng copper wiring. Okay. Wherein the arteries close to the disc becomes full and somewhat tortuous, and it develop and increase light reflex with the bright copper luster. Yan. Then, meron tayong tinatawag din na silver wiring na pwedeng makita for the patient who was hypertensive when you put light inside when you view it using the ophthalmoscope, diba? There is what we call silver wiring. Occasionally, a portion of a narrowed artery develops such an opaque wall that no blood is visible within it. Siyempre, narrow, so wala makakapasok na blood. Yan. Okay, moving on to another image of the blood vessels or the arteries and the arteriovenous crossing within the retina of the hypertensive client. We have what we call concealment or AV nicking. So, wherein the veins appears to stop abruptly. Yan, bigla siyang nag-stop dyan, nagputol on either sides of the artery. We also have what we call the tapering and bunking. Okay, wherein the vein appears to taper down and taper down on either sides of the arteries. Okay, this is an example of bunking, no, wherein The vein is, ayan, twisted on the distal side of the artery and forms a dark wide knuckle. Ayan, lumaki si vein lalo. Okay, let's move on to another findings of the internal structure of the eyes in the macula. We have what we call the macular degeneration. So look at the presentation of macular degeneration. Okay, this is also known as age-related macular degeneration, or AMD or ARMD. This is a medical condition which may result in blurred or no vision in the center of the visual field. Kasi diba, yung macula, siya yung responsible for the central vision. Early on this are often no symptoms, wala namang symptoms, but over time, however, some people experience a gradual worsening of vision that may affect one or could affect both eyes. Now, let's move on to the ocular fundi. So this is the presentation of the normal fundus of a fair-skinned person. So parang katulad ng pinakita ko in the previous slides. And this is another presentation of the normal fundus of a dark-skinned person. So wherein you can observe that the disc, the macula, the fovea, no, the veins or the retinal veins and arteries. So okay naman yung crossing ng mga retinal veins and arteries. Okay, these are another abnormal findings of the retina. We have the hypertensive retinopathy. So there is a marked areolar venous crossing changes that are seen, no? Yan, and then you can observe also a copper wiring, and there is a cotton wool spots. Yan, yung mga yan. And then for the hypertensive retinopathy with macular star, okay, so the stars are actually visible and scattered around or inside the macula. So this is the presentation of the fundus of the patient with non-proliferative retinopathy, that is moderately severe, that's one, while the non-proliferative retinopathy, that is severe. For the moderate, you can observe a tiny red dots or microaneurysms around. So, hindi masyadong kita yung mga dots na maliliit, no? Kailangan natin i-focus. But this is visible using the microscope. While the severe, okay, you can observe here in the superior temporal quadrant of the retina. You can note, di ba, kitang-kita yung large retinal hemorrhage between the two cotton spot or cotton wool patches. Okay. Nakita mo rin yung mga tortoise blood vessels. Okay, so this image shows the complication of diabetes, or we have what we call diabetic retinopathy that affects the internal structure of the eye. So this is the presentation for the proliferative retinopathy with neovascularization. So when we say neovascularization, there is a growth of a new blood vessels in the optic disc. So look at this picture. Note this picture. Note that there is a new pre-retinal vessels that is arising, okay, on the disc and extending across the disc margin. This is the disc margin. The visual acuity here is still normal. However, the chance of or the risk for visual loss na pwedeng mabulag yung pasyente is very high. Okay, so on the other side, we have the proliferative retinopathy advanced. Okay, Okay, the proliferative diabetic retinopathy or PDR, sometimes ang tawag sa kanila, is more advanced form of disease. So there is already a problem with the circulation, okay, that deprive the retina for oxygen. So as a result, merong mga bagong fragile blood vessels that begins to grow in the retina. And not only in the retina, but into the vitreous. No? Di ba alam natin yung vitreous is the gel-like fluid that fills the back of the eye. So for the proliferative retinopathy, hindi pa advanced, photocoagulation can help. Okay? So for the advanced, maybe vitrectomy is will be performed. Okay, so that's why it is necessary to refer your findings to the doctor, especially the ophthalmologist. Okay, so let us now move on to the special techniques in doing the physical examination of the eyes. Okay, so to check for nasolacrimal duct obstruction, you have to ask the patient to look up, and then you have to press the lower lid close to medial canthus. Okay, look for the fluid regurgitated out of the puncta. So alam mo naman kung nasaan yung puncta, di ba? May two openings yan, may two hole. Okay, avoid if inflamed and tender. Kapag may nag-complain si patient, aray, masakit. Okay, note for mucopurulent fluid that may suggest obstructed nasolacrimal duct. Again, meron ding technique or meron ding surgery na ginagawa dito. Okay, so this is how you will press, no, yung sinabi natin in the previous slides, to check for a presence of obstruction in the nasolacrimal duct. So, dito ka mag-press down. So, to perform this one, meron ito sa aking RLE, a video of how to do this. Okay, so moving on to inspection of the pulpebral conjunctiva. Okay, you can use a cotton applicator, okay, to invert the pulpebral conjunctiva, but be careful, not to injure your patient. Okay. So, in recording your examination, of course, make sure to note the following. Okay, the vision, is it 20/20? Or for the far vision, for the near vision, is it 14/14? Okay, acuity measurements, yun. The peripheral fields, diba? Yung check natin yung 6 movements. Kung makikita ni patient yung wiggling of your hands. Okay, the extraocular movement and the structure of the eyes. Okay, note also if there is drainage, tenderness, or pain. What is the color? Kung saan yan, the sclera ba, the color of the iris, okay, the color of the pupil is black, diba? Deformities, okay, opacity, especially on the lens or on the cornea. Alright, so after having the data from your health history taking and your physical examination, it's now the time for you to create your nursing care plan. Therefore, in your nursing care plan, you have to include your health teaching, okay, that promote health and for disease prevention and to educate your patient. So part of it is to instruct your client or to teach your client about vision screening, that those newborn to 5 years old must be assessed or must be checked for strabismus. Okay? Yung eye movement, di ba? Okay, and then ages 3 to 5, you have to ask the client to check for amblyopia or lazy eye. Okay. So, of course, para makorek ito earlier habang mas bata pa. Just like what happened in my left eye. So, it was not corrected na kasi nung bata pa ako, so hindi naman ganun ang healthcare system. Okay. For the school-age children, adolescents, and young adult, dapat ma-check din yung kanilang refractive errors. Ayan, especially during this pandemic, no, that most of our activities are conducted online. So, may eye strain, diba? All adults to evaluate the eye health. Of course, again, that is to prevent loss of vision. For client or patient age 65 or older, to check for more prevalent for refractive errors, for cataract, for macular degeneration, and for glaucoma. Okay, certain disease process should have more frequent examinations, especially for those patients who are diabetic, also those patients who are hypertensive. Kasi meron silang complications inside the internal structure of the eyes. Kasi yung ating eyes, may mga blood vessels din yan na maliliit. Like yung veins, no, from the retina, retinal veins, and the retinal arteries. Yan. So, you have to include also the eye protection. No? You teach your client to use eye protection to prevent eye injury that can occur anywhere with many different activities. Diba? Lalo na yung nagmo-motor cycle lang. Yan. Must assess the environment and activities and use appropriate protective device if warranted. Ano ba yung ginagawa niya? Ano ba yung environment? Okay, baka naman masyadong mainit yung sun exposure. Dapat may UV light or may eye protective gear. Okay? For emergency eye care education, it is important to ensure correct steps are taken to preserve vision. Avoid direct sunlight and be sure to correctly use sunglasses. Be sure there are appropriate eye wash stations in the work area. Kasi diba, pwede rin magkaroon ng infection sa ating eyes. Naalala nyo yung bago pa yung COVID, diba may mga report na pwede rin siyang nag-effect din siya doon sa eyes. Okay, so part of your health promotion, disease prevention and education is to teach your client about care of contact lenses. Teach them the proper care to avoid infection, injury, or scarring to the cornea. Teach them to follow manufacturers' recommendations for use, for care, and for storage. Of course, to use good hand washing techniques and to inspect the cornea during exams to ensure that there are no scratches or damage on the cornea. Okay, so this is the end of this topic for this week. So to end this presentation, let me remind you, future nurses, you are being called according to His purpose. Okay, so please keep fighting. Okay, so kaya nyo yan. Kaya natin to. So I'm excited to see you on stage few years from now. Okay, so God bless everyone and see you. Again, the references. Thank you everyone for your time.